Hello good guys, welcome back to Overlay. My name is Onyo Nyambura and I'm back again with a new video on the Mother and Child Handbook. So keep it locked, we're gonna learn a lot. Guys, I'm shooting at night. Don't ask me why. Motherhood, oh Lord. Without further ado, let's go into the video. Guys, I need to cover this book of mine. I don't know how it appears like deep purple, but I think it's the filter that I'm using that is changing the color of the book. In reality, this is not how the book looks. This is not the shade of purple it looks like. So guys, let's open our books. Don't forget, I hope you come to class with your textbook, because if you don't have your textbook, kindly leave. This is our textbook. This is our Bible as mothers. So if you don't have your Bible, exit. So today we're going to go to page 4. That's where we left it at, and mostly I don't want to show anything on this page. It's more of biodata, more about you, the mother, and the father also. But now we come to page 5 of the book. That's where you get some medical and surgical history. So you might find the doctor asking you some questions and you're like, this doctor have so many questions. They might ask you whether you have had any surgery. There's a reason for that question, because in case maybe anticipated complication, maybe you might have in case you're having a CS. The other thing is diabetes, and they might ask you a history of hypertension, because mothers with hypertension and diabetes are categorized as high-risk mothers, so they need to be observed and they need to come to the prenatal clinics regularly for more observation to make sure their blood pressure is okay and also their sugar levels are okay. There's also history of blood transfusion. There's history of tuberculosis, so that they know whether you're on current medication for tuberculosis. Any allergies, they need to know that, and others specify, and others, any drug allergies and others, that is in case you're allergic to proteins, in case you're allergic to eggs, yeah, exactly. Family history of twins, yeah, they need to know whether you have a family history of twins, so that in case you might get twins, and they have to be prepared how to handle the delivery. And then they have to take history of your previous birth, whether you have had any CS, such kind of things. That's what they put, and that's so brief. So we're going to open our page to page 6. We're going to tackle them together. Page 6 is more of notes that the doctors write. Mine is written because I've been using this book. Let's open our textbook to page 7. So the first part is the physical examination. The doctor who is attending you needs to comment on your physical appearance when you get into the clinic. Maybe you looked unhappy, you looked sad, you looked unkept. They need to indicate that. They have to measure your BP to make sure. Some people get high blood pressure when they are pregnant, and others get high sugar levels when they are pregnant. It's called gestational hypertension, and there's also gestational diabetes. So they also need to take that. They need to take your height and also your weight, so that they can calculate your BMI and know whether you're on the right track when it comes to your weight and height. They need to do a cardiovascular exam. They need to, I don't want to use any medical term. They need to listen to your heart and make sure everything is okay, your heart is pumping and all that. They need to take your respiratory rate, because there is a range. You might find maybe this person is dyspneic, meaning they're trying to gasp for air. You might find maybe they're breathing slowly. So they need to check on that. They need to check on your breast, girls. So when you go to the first clinic and the doctor is like, can I see you? Can I do an examination on your breast? Don't be like, oh, why would you like to see my breast? Yeah, some women get something we call retracted nipples, and when you give birth, your nipples are retracted. God, it's not gonna be good for you, because your child will not be able to suck on those nipples. When they need to do the abdomen, they need to check your abdomen. They need to feel how far your pregnancy is. You can tell how far the pregnancy is in weeks by just palpating. That the doctors might understand better. They need to do a vaginal examination, but this one, depending whether there are any issues, but if there are no issues, this one can be skipped. They need to look at your genitals. Guys, I know most of the clinics will be like, why do you need to do an examination on my genitals? Yeah, you might find some people have warts. They have genital warts. Most of them are very massive. And when you have genital warts, there's no way allowing a baby to pass through there. Yeah, we have to prepare for an elective CA so that you don't get your child having warts immediately they are born. So you need to know whether you have any genital ulcers. For example, you might have a syphilis ulcer, which is not tender, but not, it's never picked. So you need to do a genital examination. Don't get surprised when your doctor wants to. There are some tests that you do when you go to the clinic. It's called the Antenatal Profile. And each test there is as very, very important as for the progression of the pregnancy. We'll look at the first one, the HB level. That is the blood. Let me use the layman terms. It's the blood level. Because you might find maybe somebody comes in with a HB of 8 or 7. That is somebody at high risk. They need to boost their blood levels before they go to the delivery. Because delivery is a messy procedure and you go bleed, sister. So you need a lot of blood so that when you bleed, you are left with some for your heart to pump. The other thing is your blood group. You need to know your blood group. The reason for the blood group is you might find somebody is blood group O negative, the lady, and then the father is blood group O positive, and then you're having a child who is blood group O positive and you're negative. Your body will recognize that as a foreign thing and will start reacting, and that's why you find people with habitual, something we call habitual abortions. The first pregnancy is a bit safe, but now your body, this consecutive pregnancies, your body is already sensitized. So the reaction will be worse and you might end up most of the time losing the consecutive pregnancy beside the first one. So you need to know your blood group, because that's when your blood group O negative or B negative, whatever, rest as negative, you need to get your anti-D's injection to avoid that reaction and losing your baby. Then there is VDRL. VDRL is the syphilis. You need to check for, because syphilis can pass through the placenta and go to the baby and might cause a lot of issues, and you don't want to give birth to a baby who is positive with syphilis. Yeah, exactly, and also can affect the development of the baby. Then you have to do TB screening. This one is very easy. You're not coughing, you don't have night sweats, you have not lost weight, and whatever. Simple things. You don't have to go for lab for that. And then there is HIV test. Very important, because if you found that you're HIV positive, you need to plan for your delivery. After delivery, your child has to start nevirapine if you're positive, so that they don't contract the virus also. And then you have to be under very constant monitoring during and after birth. Then there's urinalysis. We need to check your urine, girls, because we always say urinary tract infection can lead to loss of pregnancy. When you have candidiasis moving and you have bacteria moving all the way, they can affect the amniotic sac and you might end up losing your pregnancy. So you have to make sure that area is free of bacteria, okay? And then HIV testing should be done as a couple. It's not for you alone. Remember, this is where the role of the father comes in again. The father needs to go to do a urine test together, because I might have UTI, he might not have it. Or he might have UTI, but I don't have it. So it needs to be tested. The other thing is, they need to be tested for their blood group in case they don't know their blood group, so that also we know their rhesus status. So infant feeding. You need to discuss with your doctor. This one, I say for sure, nobody discussed during, after delivery. Nobody discussed this with me. I don't know why Kenyan doctors or Kenyan health practitioners assume after you give birth, it's so natural for you to just hold the baby and they start sucking. It's not that natural to some people. So you need to discuss how they're going to start breastfeeding, what modes they're planning to use to feed their babies. Because my fans are really like, oh, I'm doing formulas, I'm not breastfeeding my babies and I risk my boobs sagging. So you need to discuss with your patient. This you need to discuss with your doctor, the pros and cons of not breastfeeding or of breastfeeding. For women who are working, actually, you need to be taught by your doctor how to transition the baby from breastfeeding to bottle feeding, because I'll tell you, I'm struggling with that. Trying to transition your baby from breastfeeding to bottle feeding so that you can go back to work. Whew, the last thing I want to do again. So you need to discuss whether you want to do exclusive breastfeeding, whether to introduce a formula or whatever. That's all that you need to discuss with your doctor. And unfortunately, these are things that they're never discussed during the clinic, and we all assume like every giving birth mother, we just hold the baby and start breastfeeding. Such a bad notion. This one should be discussed. So I'd say for sure during my clinic, all these things, it's only that I do read my book, but most of the things we never discussed with the doctor who attended to me for the, I think, 4 visits that I went during my pregnancy. We barely discussed nothing. I remember the only thing we discussed with the nurse was the tetanus vaccine that I was given, and she was telling me the importance of the tetanus vaccine and all that. But the doctor did ask, how are you doing? How are you feeling? You okay? Okay. Just go get your vaccine, get your iron supplements, and I was home. Nothing. I don't know the danger signs. I don't know nothing. I'm just waiting for anything to happen. But I'm here to help you with that. I'm here to teach you so that even if you don't discuss this with your doctor, or you might ask questions when you go to the clinic and ask your doctor, but I had this, how does this work? Okay guys, so stay informed. Let me see you next time on our next video, and with that, have a good night because I'm going to sleep. The rest of you waking up, have a good day, have a good morning, good afternoon, and bye guys.